I want to thank the organizers for inviting me to speak today. And I'm going to describe to you some results from a U-Series translational grant that was awarded to my lab and my corporate partner, NeuroPace. And the goal of this project was to collect preclinical evidence that low-frequency 1 hertz stimulation was efficacious and safe as a potential treatment for epilepsy. You'll hear several talks today talking about how approximately 30% of the patients with epilepsy, there's no current therapy available to treat their seizures. And although a high-frequency, low-pulse duration, deep brain stimulus has been approved for the treatment of epilepsy, there are clearly still patients that don't respond. So the goal is to see if we can come up with additional stimulus paradigms that could be used to decrease seizure frequency in patients that don't respond to anti-seizure medicine or to other stimulation therapies. And then the goal would be, if they get FDA approval, then the NeuroPace would incorporate that stimulus paradigm in their responsive neurostimulator, which you see in this cartoon here, which has the ability for seizure detection as well as then delivery of therapeutic stimulation, either through a subcortical strip or through depth electrodes. Which way is forward? This one?
Yeah, no, this one.
Okay, great. Our first approach was to test low-frequency stimulation in the kindling seizure model. Kindling is a model where an electrical stimulus is delivered to either a limbic or cortical structure, but the stimulus is subconvulsive. But the repeated presentations of the stimulus over time results in eventually a change in brain function so that the animal always responds with a seizure whenever the stimulus is delivered. And we score the behavioral convulsion on a 1 to 5 scale, with 5 being the most severe of the behavioral seizures. And we also collect electrographic epileptiform activity, which is called an after discharge because it's occurring after the stimulus. Here you see an after discharge from a control animal that has received 6 stimulations. And what happens during the kindling process or kindling acquisition is that the duration of this after discharge will grow. Underneath it, you see an after discharge from an animal that received 30 seconds of preemptive 1 hertz sine wave stimulation before the kindling stimulus was delivered. And this is after 12 stimulations. And you see the after discharge duration has been shortened by this therapeutic stimulation. This slide was donated to me by my colleague Dan McIntyre, and he used a similar 30-second or 90-second low-frequency stimulus and showed that the amount of current necessary to elicit an after-discharge as a consequence of these seizures, the threshold, was elevated for a number of days with just a 30-second or 90-second application. And you can see the 90-second application has a much greater response. Now, when the animal is getting stimulated to become kindled, we call that kindling acquisition. And what you're looking at here is a control and experimental group where the controls were just kindled 1 stimulus a day in the amygdala, and then the experimentals received the low-frequency stimulus before the kindling stimulus. And you see the low-frequency stimulation shortened the duration of the seizure, and the animals never really became fully kindled, experiencing 3 stage 5 seizures in a row. So it interfered with the kindling process. When we examined the low-frequency stimulus in animals that were already fully kindled, these animals respond approximately 100% of the time when they receive a stimulus, they have a stage 5 seizure. You see the low-frequency stimulus decreased seizure frequency by 60%. And when these animals failed, they failed completely. They didn't have any intermediate scores or any after discharge whatsoever. So in summary for this portion of the talk, low-frequency stimulation raised after discharge threshold, interfered with kindling acquisition, decreased the incidence of stage 5 behavioral seizures, and moving forward, we decided we wanted to move into a model where the animal is having spontaneous seizures. So we transitioned into the tetanus toxin model. Tetanus toxin, when it's injected into the hippocampus, results in the animal having spontaneous seizures. And they're random and very similar to human epilepsy. And the other advantage of the tetanus toxin model is that it doesn't cause a lesion. And so here you see an electrographic seizure from the hippocampus of a rat injected with tetanus toxin, and here is one from a patient with mesial temporal lobe epilepsy. We modified the stimulus slightly to ensure that we weren't getting hydrolysis at the electrode tip, so we switched to voltage-controlled low-frequency stimulation, and we limited the voltage to 1 volt peak to peak. And so during this experiment, 1 minute out of every hour, the animal received continuous low-frequency 1 hertz stimulation. Here you see the records of an individual animal. The blue bars are seizure detections before low-frequency stimulation was initiated, and then the green bars are after the low-frequency stimulation was initiated. And you see there's a dramatic decrease in the number of seizures that this animal is exhibiting. And each one of these bars is a daily record of their seizure frequency. This is a responder plot from all the animals that we looked at, and the blue bars, once again, are controlled, and the green bars are the ones that receive the voltage-controlled stimulation. And you see some animals get worse without stimulation. Even some animals get worse with stimulation, and some animals have a decrease in seizure frequency without stimulation.
1 minute.
Okay, thanks. However, when you look at the comparison between the two groups, the low-frequency stimulus significantly decreased the number of seizures in the tetanus toxin-treated rats. For safety, we did histology. The top row is animals that did not receive low-frequency stimulation, and the bottom group are those that did, and there was no evidence of damage using this low-frequency stimulus. So in summary, scheduled low-frequency, voltage-controlled low-frequency stimulus significantly decreased the number of spontaneous electrographic events in tetanus toxin-treated rats, and there's no evidence of damage associated with this stimulus. And so hopefully we'll be able to transition this into a clinical therapy. Thank you.